And I just want to note that I've worked with a number of my colleagues across the aisle to attempt to improve the Medicare Advantage program. So this is a bipartisan issue. In fact, I'm working with Mr. Arrington to ensure that MA plans promptly and fairly pay providers for services to ensure stability for our hospitals and less delays in care for patients. I've also worked with Ms. Van Dyne to ensure that patients entering post-acute care have access to the appropriate care setting, irrespective of whether they are on MA or fee-for-service Medicare. And I welcome those conversations. I think we need to have those conversations, and I think we need to have those thoughtful conversations. But we should have had them 2 months ago when we were marking up the one big ugly bill. A lot of Republican colleagues want to root out waste and fraud in the MA program, but let me be clear about what happened. 2 weeks ago, Republicans cut 17 million Americans' health care to root out waste and fraud. Republicans triggered $500 billion in cuts to Medicare to root out waste and fraud. And for what? Because Republicans blew up our deficit by $3.4 trillion. And that's according to the Nonpartisan Congressional Budget Office, their report that came out yesterday. So you're going to have to forgive me if I'm a little cynical and I don't believe in their commitment to the program integrity.